CMA AAMA Practice Exam Online. Let's get started. Patient requests full medical records for new specialist. Per HIPAA, the MA. Is it A, emails immediately? Or B, requires signed release form, provides within 30 days, reasonable fee? Could it be C, needs specialist request? Or lastly D, denies unless court-ordered? The correct answer is B. Here is why. Requires signed release form, provides within 30 days, reasonable fee. B is correct. HIPAA grants patients the right to access their records, but a signed, HIPAA-compliant authorization is required before release. The provider typically has 30 days to provide copies and may charge a reasonable, cost-based fee. Emailing immediately, A, without proper authorization violates privacy. A specialist's request, C, is not sufficient without patient authorization. Denying access, D, violates HIPAA unless a specific exception applies. Next question. Patient with crushing chest pain, diaphoresis, radiation to arm arrives. Priority for MA. Is it A, detailed history first? Or B, activate EMS, support ABCs, prepare ECG/aspirin per protocol? Could it be C, give nitro from cart? Or lastly D, ECG then call provider? The correct answer is B. Here is why. Activate EMS, support ABCs, prepare ECG/aspirin per protocol. B is correct. This presentation is classic for acute myocardial infarction, a time-sensitive emergency. Immediate activation of EMS 911 is the first priority. The MA should then support ABCs, airway, breathing, circulation, and assist with interventions like ECG and aspirin administration per established protocols. Taking a detailed history first, A, delays emergency care. Administering nitro, C, without a specific order and prior assessment is dangerous. Performing an ECG before calling for help, D, delays definitive care. Next question. Preparing sterile field for IND procedure, MA. Is it A, opens pack, sets field, dons sterile gloves last? Or B, gloves first, handles everything? Could it be C, uses non-sterile gloves? Or lastly D, sterilizes after? The correct answer is A. Here is why. Opens pack, sets field, dons sterile gloves last. A is correct. This maintains asepsis. The sterile field is established with non-sterile hands, using the outer wrapper of the pack, and then sterile gloves are donned to handle sterile items within the field. Donning gloves first, B, would contaminate them while setting up. Using non-sterile gloves, C, contaminates the sterile field. Sterilizing after, D, is incorrect. The field must be sterile before the procedure begins. Next question. New patient has non-contracted insurance. MA should. Is it A, collect full payment or payment plan, give superbill? Or B, bill insurance anyway? Could it be C, refuse visit? Or lastly D, treat as contracted? The correct answer is A. Here is why. Collect full payment or payment plan, give superbill. A is correct. For non-contracted, out-of-network insurance, the patient is typically responsible for the full fee at the time of service. The practice can provide a superbill for the patient to submit to their insurance for possible out-of-network reimbursement. Billing the insurance directly, B, without a contract often leads to denial or lower payment. Refusing the visit, C, may not be appropriate. The patient can be seen as self-pay. Treating as contracted, D, would result in incorrect billing and potential financial loss. Next question. Vein collapses mid-draw on elderly patient. MA. Is it A, adjust needle gently or re-tourniquet briefly? Or B, restart opposite arm? Could it be C, milk arm hard? Or lastly D, label partial? The correct answer is A. Here is why. Adjust needle gently or re-tourniquet briefly. A is correct. A collapsed vein may be due to suction or low pressure. Gentle adjustment, slightly withdrawing or advancing, or briefly releasing and reapplying the tourniquet may restore flow. If unsuccessful, then the opposite arm, B, may be attempted. Milking the arm hard, C, can cause hemolysis and tissue damage. Labeling a partial tube, D, is not a standard solution for a collapsed vein. It's better to obtain a full sample if possible. Next question. Teaching inhaler use with spacer to asthma patient, emphasize. Is it A, quick inhale, no hold? Or B, shake, exhale, slow deep inhale while actuating, hold 10 seconds? Could it be C, use only attacks? Or lastly D, rinse if steroid? The correct answer is B. Here is why. Shake, exhale, slow deep inhale while actuating, hold 10 seconds, B, is correct. This is the proper technique for a metered dose inhaler, MDI, with a spacer to ensure medication reaches the lungs. Shake the canister, exhale fully, place mouth on spacer, start a slow, deep inhalation, actuate the inhaler once during inhalation. Hold breath for 5 to 10 seconds to allow deposition. A quick inhale, A, reduces lung deposition. Inhalers are often for maintenance, not just attacks, C. Rinsing after steroid inhalers, D, is important to prevent oral thrush, but it is a separate point, not the core technique emphasized here. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.